DVT means deep vein thrombosis. In our body, there are different kinds of veins depending on the depth from the skin. Deep veins are mainly the highways of our leg and hand. So whenever a clot is nothing but a blood which gets basically converted into a solid structure which is called as thrombosis. This gets accumulated and the blood stops in your leg or maybe upper arm, upper leg, hands, then this is called as deep vein thrombosis. DVT is really a dreaded disease and cannot be taken lightly. The causes of DVT are divided into basically immobility. Whenever a patient is really obese, he is not walking a lot, she is not walking a lot. If the patient undergoes a major surgery and is immobile, in some patients the cause of DVT is basically long journey, for example long flights, 12 to 14 hours, 15 hours flight. Other reasons are whenever a patient comes with sudden DVT, then we have to look for genetic factors. Some patients do have deficiency of certain proteins which leads to formation of DVT. So these are common reasons: post surgery, immobility, genetic factors, and certain drugs such as hormones, oral contraceptive pills can also lead to DVT. Whenever a patient develops DVT, the symptoms are initially mild. Patient will feel mild swelling, redness, pain in the affected area, mainly in the calf region whenever there is DVT in the leg. Slowly there is progression of the swelling. Patient will see in 2 to 4 hours the leg has swollen like really big in size. The pain has increased. He or she cannot walk. So these are usually signs of DVT, and if the clot migrates and goes to the chest, which is called as pulmonary embolism, then the patient will feel difficulty in breathing, which is called as shortness of breathing. As soon as patient has unusual symptoms in their leg or upper limb, he should rush to a doctor nearby, a general physician, whoever is available. If a vascular specialist available, then that's the best place to go. For diagnosing, the doctor will do clinical examination. He will touch your feet, hand, do certain tests, maneuvers to look whether there is pain, tenderness. He will ask you to do a very simple test again, which is called as color Doppler of the veins. This is nothing but ultrasound, and this ultrasound will quickly diagnose the DVT. DVT is nothing but the person who will be doing the Doppler will see the veins, and there will be a clot which will be seen nicely, and the diagnosis of DVT is made. In certain situations, when the clot goes inside your belly, which is not clear on ultrasound, then the doctor will advise to do a CT venography. It's nothing but a CT scan. So prevention is better than cure. Everyone should try their best that she does not develop DVT. If you are overweight, if you are having a very sedentary lifestyle, try to lose weight, try to walk every day, drink plenty of water. If you are having a long flight, then in the flight drink lot of water, try to walk a lot as much as you can. Whenever they allow you to walk, you should wear stockings which are compression stockings to prevent DVT. These are available in the market. And whenever a patient undergoes any surgery, most of the doctors will give them some blood thinners and will ask their patients to move as soon as possible post surgery. Whenever you are on any medication, check with your doctor whether these medications will make you prone for DVT and whether any other medications are to be taken to prevent DVT. Once DVT is diagnosed on CT scan or Doppler, it is your moral responsibility to go to a vascular specialist, because depending on the amount and location of the clot, the treatment differs. If there is a very minute amount of clot, you will be started on a special medicine which are called as blood thinners, and this blood thinners will try to dissolve the clot. However, if the extent of the clot is large, if long segment of the leg is involved, then there are various ways to treat. In modern medicine, the vascular specialists have latest ways to remove this clot without cutting or without doing an open surgery. It is called as catheter directed pharmacomechanical thrombolysis. The entire clot can be taken out with just one single needle puncture hole, as we do in angiography, and your clot can be your leg can be devoid of, I would say, the clot. However, if you reach your vascular specialist really late, like after 2 to 4 weeks, this clot will become really hard like a cement, and then it becomes very difficult to remove the clot. So time is very important. Time is life. As soon as a DVT is diagnosed, rush to a vascular specialist, rush to a hospital in which a vascular specialist is available, so that he can easily remove this clot by latest methods which I have described. Thank you.